I'm so pleased to be joined once again by Newsmax TV contributor Morgan Thompson. And Morgan, we are joined in turn by our friend Skyping in from Washington, D.C., the former Deputy Secretary of the U.S. Department of Health and Human Services. He's currently president of the American Health Policy Institute, Tevi Troy. Tevi, I think a lot of people, when we heard Dr. Frieden a couple of weeks ago, he sounded as if he was tamping things down. The other day, his message seemed to be, I don't want to say, he conveyed a message of urgency. So a lot of people are wondering about this. Tevi, you've looked at these things closely. What is your take on what's going on in West Africa right now?
Right. Well, first of all, I do want to reiterate what I've said on the program before and what CDC has been saying. This does not appear something that is a major worry inside the U.S. We know how to control its spread and limit its spread, and so I don't think people should be panicking here. However, since the last time I was on your show, JD, things have worsened in West Africa. We're looking at 1,900 dead. Projections say that 20,000 could be infected, perhaps even going up to 100,000, and the overmatched countries there really don't have the resources to deal with it. I saw that USAID is going to give $75 million in supplies. I think that's a good first step, but I do think we need a stronger international response to deal with what's going on in West Africa.
Now, Tevi, the World Health Organization predicts 20,000 will get this disease within the next 9 months, and of that number, about half will die. Why is the death rate so high, and is there anything that can be done about this?
Well, Ebola is devastating. Once you get it, we don't have a treatment that we have large supplies of and that we know works. ZMapp, as you mentioned earlier, is not only experimental, but there are very few doses of it, and it takes a long time to produce more doses at this point. So if you get Ebola, it is a real problem, and it has about a 50% mortality rate. The thing that we are good at in the U.S. and in other Western advanced nations is controlling the spread of it by using smart infection controls, limiting the spread of it through bodily fluids. It is not an airborne illness, and so it's easier to control. But if you do get it, it is very, very worrisome and deadly.
Tevi, two questions about the doctor who was infected, the latest American case. Dr. Sacra was not dealing with the Ebola patients as our previous two Americans were. He was, I believe, a family doctor. So what does that tell us about the spread and his treatment at the Nebraska Medical Center as opposed to coming back to Emory? Can you give us some insight on those two questions?
Yeah, well, on the first, I read an article this morning that said that Dr. Sacra, and I pray for his recovery, knew the risks in going there. And these people, these frontline healthcare workers, are real heroes. And even if they're not directly dealing with Ebola, going into that region is a dangerous region. I can't really speak to the Nebraska facility question. I know that Emory has top flight doctors and has dealt with this before. But, you know, these days, modern technology, I mean, if the Emory doctors have communicated to Nebraska doctors how best to treat this, I think that's a good thing. It's good if we have more doctors across the country who know how to deal with this situation.
Now, the World Health Organization says it's going to take about $600 million and thousands of people on the ground to help combat this. Is there a way that a general public can donate? I know they need medical supplies, they need protective gear. Is there a place where we can donate money to help this?
That's a good question. It's also worrisome in that initially the World Health Organization was saying less than 100 million to contain it, and then they were saying 400 million, and now you're saying the latest figures is 600 million. I am not sure of the best place to donate, but I'm sure that there are online resources that can educate you on that front.
Well, and
I would urge people to do it.
And what's interesting too is the World Health Organization. There are those of us who have some cynicism because it always seems that their requests for money and manpower grow exponentially. Perhaps that, to be fair though, perhaps that's in response to the spread of the disease. We have a map from the CDC that shows us the spread of this West African strain of Ebola. We have it here on our screen. Tevi, from your perspective, still relatively isolated, or are you concerned about intercontinental infection to Asia and ultimately here to North America?
Yeah, again, I think we can control it in North America. Asia is a worry. And look, in these days of international air travel, the diseases can spread. Fortunately, countries and health officials around the world are now on the lookout for Ebola, and it's gone farther in Africa than people would have liked, or certainly than I would have liked. But I think at this point it's still controllable, but it will require more effort than it would have a couple of weeks ago.
So we've got just over a minute left, but it's important to mention ZMapp, the serum that's really had good luck treating these doctors. Can you give us an update on any vaccine trials? What process do they need to take? Is there a way to get this mass produced quickly?
Yeah, I believe that GSK GlaxoSmithKline is working on a vaccine. There are all sorts of steps that have to go on the regulatory front, like going through the FDA. And companies don't mass produce these kinds of things until they get that full approval. So once they're ramped up, companies are usually pretty good at doing mass production, but I think it might take a while. So I would not expect a vaccine to be able to tamp down this current outbreak right now in the fall of 2014.
Tevi Troy, your insights on public health, very much appreciated. Thanks once again for Skyping in today from Washington, D.C. When you think about this really, to the layperson, it's still pretty scary, but Tevi brings a voice of reason and enlightenment to it. We'd like to get your take on Ebola. Why don't you tweet us your comments at NewsMax TV, #AmericasForum.